enjoying your third day?
Yes.
Okay. Myself, Dr. Megha Bhatat, MD Scholar first year from Department of Panchkarma. Today I am going to teach you 4 topics of Panchkarma. So, if any query you have in any topic, you should note down, and after the completion of one topic, I'll handle that queries. Okay. It will all convenient to you.
Yeah. Yes. Yes.
So, first procedure is lay. What is lay? In this procedure, there is application of medicine is done at the affected parts and allow for drying for specific time period. Is there any need to translate in Hindi? I'll okay with that.
No.
No? Okay. So, in the lake, what will we do? We take the fresh herbs and apply on the affected part and allow it for drying. And if the herbs are not fresh, if we have dry herbs, then we add some media to that dry herbs or dry powder and make them into the form of a paste and then allow it for drying. Requirements: quantity based on the size of lesion, the lesion on which we apply on the lap, how much the lesion is, that their size, on that the quantity of lap is applied. Media: hot or cold water, milk, oil, arnal, cow's urine, ghee, swaras, lemon juice. Quantity based on parts used: bowl or vessel to put the churn in that, spoon to stir the lap, heating apparatus, plastic spatula, sterile cotton swabs, sterile both pad, cold water 50 ml, cold water 50 ml. Preparation of the lap: add sufficient quantity of churn in bowl, add sufficient quantity of required media, mix it well till it becomes paste. For example, 4 into 4 area of lesion, if we have to make thin paste, then we have to take churn 3 gram and the media in which the churn is mixed is taken to be 10 ml. And for thick paste, the churn is more than the thin paste, that is 5 gram, and media is same, that is 10 ml. Pre-procedure: gloves are worn and the lesion is properly cleaned with sterile swabs dipped in clean warm water and allowed to dry. Position: patient is placed in the supine or prone position on the table. All you know about the supine and prone position?
Yes.
Okay. This procedure is basically for any skin lesion. If there is any lesion present on the skin, then we have to go on the gloves. Otherwise, if we have to do the lap to increase the complexion of the skin or for any cosmetic cause, then we don't have to put gloves. Main procedure: the lap is applied over the lesion with the help of spatula in an upward or reverse direction of hairs over the skin. As you told earlier, in which direction we will do udvartan, that is in upward direction or reverse direction of hairs. In the same direction we have to apply the lap also. Care is taken not to extend the lap over the normal skin. Now, what is the thickness of the lap? If we have to make a thin layer, it is approximately measured as 0.5 mm. Moderate thickness of lap is 0.7 mm, and thick layer of lap is approximately 1.1 mm. Duration of lap before the lap dries. Post procedure: lap is allowed to dry, but before drying completely, the area is moistened and cleaned with warm water and dried using sterile gauze pad. Indications where we have to do the lap. Firstly, mainly it is indicated in the skin disorders like leukoderma, to reduce localized swelling due to infection, to reduce the poisonous effect caused due to insect bite after coming in contact with poisonous plants, etc. And lastly, to increase the complexion of the skin, remove black spots and pimples. The last one we will do in our homes also. Precautions. It is very important to what precautions we have to take before applying the lape. Lape should not be applied at night time. One lape should not be followed by another lape over it, because as the density and compactness of material increases, it causes rise in temperature, burning sensation and pain. Before applying to particular part, it should be tested over small area behind earlobe. A lape dried one should not be reused by mixing any solvent into it. A lape should be applied lukewarm, as the heat facilitates the skin permeation of the drugs fastly. That is first procedure, lape completes. Any query?
Yeah.
Yes.
Can we use it for psoriasis and these diseases also?
Yes.
And what is the churn that we use here?
Basically, there are many churns for according to the disease. Like in leukoderma, we can use Shvitragan lape. It is made up of bakuchi, cow's urine. These are the ingredients that are put in the lape. And for complexion, or to increase the complexion of the skin, we will use Rakt Chandan Adi lape. It contains Rakt Chandan, Manjishtha, Lodra, means all the herbs that are used to increase the complexion. And one famous lape, that is the Shang lape, we will use. It is used basically to reduce the poisonous effect of any insect bite, etc., or also to reduce the localized swelling. Like in knee joint pain, we can use that, the Shang lape. Firstly, we will apply the lape and then cover it with Ark Patra. You know Ark Patra?
Yeah, ask if it.
Shang lape.
The Shang lape, the Shang lape.
Is there any specific one which you can use, like let's say we can use Tripla for
Yeah.
Udvartana? That's
Yes.
like a regular thing. So is there any regular thing which we can use in all the kind of things?
Even Tripla is used mixed with honey in the mouth ulcer.
Okay.
Or Swatik Basram, means Fatkari.
Yeah.
It's powder form mixed with the honey, is applied on the mouth ulcer also.
So what's the most safest one which we can use in like almost all of them?
Injuries and wounds and everything.
In everything.
Yeah.
Like,
Common lape.
Common lape,
Common
common
lape.
lape.
Yes.
no common
Which we can apply everywhere.
like Tripla we could do it in Udvartana,
Yes.
and sesame oil we could do in like
There are
that one.
different lapes.
Abhyanga.
Different
Is there any
lapes.
The
specific?
Shang lape is most commonest of all.
Like in every disease or issue we
The Shang lape, yes, it is safest.
Bishang or Dishang?
The Shang, the
Shang,
Shang,
the Shang.
the Shang.
And you have here use a line, care is taken not to extend the lepa over the normal skin. What's
Yes.
that?
If we doing the lape on this any skin lesion, means if we use in any skin disease, okay,
Yes.
we have to apply the lape only on that particular lesion, on that part.
Okay, okay.
We don't have to extend that lape on the normal skin.
Okay.
The shang is made up of what?
The Shang is made up of, basically it has Shirish, Tagar, Vacha, Devdaru, Haridra, all that.
And in this as well, we need to do the Abhyanga first, right? And then we apply the.
No, we don't have to
You
do
don't have to,
the, no.
it has
I
already-
told you in the pre-procedure, no need of any of them.
Okay.
Only we have to clean that lesion, just that.
And which oil we have to use for this lepa? Like for the powder?
It depends on, mainly we have to use that sesame oil,
Okay, that's fine.
or we can also use cold water, cold water, according to the medium.
Okay, paste can be made either with the oil or the water.
Generally, if we have to use the lait for to increase the complexion of the skin, we can use milk
Okay.
or ghee.
Mhm.
And if we have to use all these lait to reduce any swelling or in any disease, we can use sesame oil.
Okay.
Can this be used in warts? W-A-R-T-S, warts. What?
Yes.
W-A-R-T.
Yes.
No, will the warts fall off in 2-3 days or so?
No, not in 2-3 days. That depends upon the severity of the disease.
Because there is one medicine given by Ayurvedic only, which is called water silk. That normally removes the warts within 2-3 days.
That's again that depends upon the ingredients that contains the medicine. If we specifically use the medicine that made up of that herbs, it can give best outcomes.
You said we don't extend the lesion wala lap somewhere else. Why don't we do that?
What?
We don't extend the lesion area lap somewhere else. Why don't we do
Because in the lesion area there are in Ayurveda doshas are present. That is not normal skin. That is affected skin.
Okay.
Already that is vitiated skin.
Okay.
So why do we have to
spreading
them?
And what is swaras?
Swaras is the juice, basically juice of the fresh herbs.
Okay.
It is also used in the lesions which are visible only, or it is also used which are not visible?
Internal.
Like swelling internal.
Internal swelling.
Swelling, we can use the lap on the swelling also.
That can be extended.
Yeah.
That can be. Okay.
Yeah.
Meaning of karma.
Arnal. Arnal is fermented gruel. That means we can use some herbs and some oil and put it into a vessel, and then we will ferment it for a period of 7 days, minimum 7 days, and after that that Arnal is. It is a whole new procedure, new kind of medicine.
So lepa is something, it has particular technique or just apply that thing? Although we'll learn it for sure. So is there any technique to apply it? Just
No,
apply
no,
it. Just
just
apply
apply
it.
it.
Just apply it.
And upward and downward both directions are.
Upward, only upward direction.
Just like Udvardhana.
Yes.
Okay. Thanks.
Shall we proceed to next?
Yes,
Yeah.
ma'am.
So next procedure is Kavala and Gandusha. We will learn it both together, Kavala and Gandusha. Firstly, what is Kavala? Procedure of holding oil or decoction in the buccal cavity followed by gargling for a certain period is known as Kavala. And now what is Gandusha? Procedure of holding oil or decoction in the buccal cavity for certain period without any movement is known as Gandusha. So basically these both are same procedure, but the basic difference only is that in the Kavala we have to do the gargling after holding the oil or decoction. We have to continuously move that fluid in our throat. But in Gandusha we don't have to do any movement. We only have to hold that particular medicine. Requirements: oil for Abhyang, heating apparatus, 2 feet long, 1 foot wide towel for Swedan purpose, knee-high chairs, medicated oil or decoction for Kavala as per the prescription, lukewarm water, sputum pan, 1 therapist. Pre-operative procedures. Patient counseling. The patient is counseled about the procedure, its benefits and any untoward effects. Procedure should be started after evacuation of the bowel and bladder and brushing the teeth. Preparation of medicine. A lukewarm medicine is to be used is heated to approximately 40 degrees Celsius. Positioning the patient. Patient is made to sit on a knee-high chair with his arms resting on the armrest. Massage to the face and front part of the neck. Swedan to the face and neck. Main procedure of Kavala. Patient is asked to take about 100 ml of lukewarm medicine or as much as he can accommodate in his mouth. He should gargle with medicine by moving it between the throat and cheek inside the mouth. By tilting the head slightly backwards and resting on a headrest, medicine may be gargled comfortably for a certain period. Then he is allowed to spit out the medicine. That is the whole Kavala procedure. And the first picture, we have to prepare the medicine. The medicine is prepared. In the second picture, we will be doing massage on the face of the patient. Then we will be doing massage on the neck of the patient. Then with the help of any towel which is dipped in the warm water, we have to do mild fomentation, mild steam of the neck and face of the patient. Then we have to ask the patient to drink the medicine. Then patient drinks the medicine and hold in his mouth according to his or her capacity. And in the cover procedure, he have to gargle that medicine, means move that medicine in his mouth. But in the Gandusha procedure, till there the procedure is same. But from there, he don't have to do any movement in his mouth. He only have to hold the medicine. Main procedure of Gandusha: patient is asked to take about 100 ml of lukewarm medicine or as much as he can accommodate in his mouth. He should hold this medicine in the mouth undisturbed without gargling for certain period. By tilting the head slightly backwards and resting on a headrest, medicine may be kept in the mouth comfortably for a considerable period. Then he is allowed to spit out the medicine. Post-operative procedure: gargling with warm water to clear the medicine and taste of the medicine in the mouth. Duration: till the patient develops following symptoms, we have to do Gandusha and cover both. First, filling of the throat by oropharyngeal secretions, watery discharge from the nose, watering of the eyes. Benefits of cover: to relieve pain, to relieve burning sensation, to remove impurities from tongue and denture, heal ulcers of oral cavity, cleanse the oral cavity. Benefits of Gandusha: improves the strength of mandible, voice becomes more effective and melodious, nourishes the mouth, improves the capability of the tongue in perceiving the taste sensation, enhance appetite, prevents dryness of the throat. By its regular practice, lips never develop cracks, increases stability of teeth and gums. By its regular practice, one can prevent toothache. By the use of Gandusha, there will not be any fear of developing dental hypersensitivity. Preventive measures: medicine should not be too hot or too cold. Patient should not hold the medicine above his tolerance powers. Uniform gargling to be maintained. Ati Yog Lakshan: in excessive kaval, there is erosion in mucous membrane of buccal cavity, dryness, excessive thirst, loss of appetite, improper taste perception. So we don't have to ask the patient to hold the medicine more than the exceeding time. He should have to hold the medicine only according to his tolerant power. Otherwise, these symptoms can develop. Emergency management: if the symptoms of over effect produces, procedure should be stopped immediately. Patient is said to keep cold milk in the mouth to relieve the symptoms. Consult to your Ayurvedic doctor. Any questions?
Yep. So you say he is supposed to keep it till the tolerance level. If his tolerance level is 30 minutes, then he'll keep
No
it.
issues.
1 hour then?
But basically, its time period is 20 to 40 minutes. In that time period, we have watering of eyes, watering from our nose, the oral secretions from our in our throat. That our capacity will die.
The muscle will get tired.
Yeah.
But isn't 20 minutes, 40 minutes too much?
According to the strength of the patient.
Okay, but that
Some will also in 5 minutes.
too boring to keep it for 20-30 minutes.
Every therapy is boring.
Try 40 minutes and you will see you cannot make it that long.
Yeah, I
Yeah.
heard that.
You will experience in hands-on training time.
Okay.
And we can do it with decoction and oil.
You can both.
Both.
With decoction also, with oil also, with honey also, with milk also.
Only honey.
According to according to the severity of disease. But if you have to do it daily, you can do it with simple tilte or with the even simple warm water.
Okay, so in Gandusha you got to fill your mouth completely, so there's no place to swish.
Yeah,
Completely pushing the walls.
yeah.
Okay, and in this gargling.
In cover,
Then okay,
Yeah.
that makes sense.
And is there
What
any?
precautions one need to take? What precautions one need to take after this procedure? After this?
After doing this.
after there is no any specific precaution we have to take after.
Like you can't eat something for a while.
Lukewarm water.
And we can do it any time, right? In the evening, night, no problem.
Mostly we have to do it in the morning.
In the morning.
And we can eat immediately after that.
Not immediately,
Like,
after
5
20. Yeah.
And for decalcification, right? For tooth, whatever we have.
Yeah.
Generally, what do we use so that you don't have that calcification on the teeth?
This therapy is effective.
Yeah.
Ma'am, what oil is used?
Lepa Gandusha is equally effective.
Basically, Tripla is commonest, easily available, and Tripla is best for any. Or if you hold the oil, then sesame oil is best.
Okay, sesame oil is better. Otherwise, you just mix the Tripla thing with the water and this.
Yeah. No, you don't mix it in the water. You have to make decoction.
Decoction of it. Like heat it at that.
What is that?
We need to boil it.
Yeah. Say we will take 4 cups of water and add half spoon of tripla powder in it. Then we have to reduce the water till it becomes 1
One
cup.
cup, one. Okay.
One.
That is detoxification, main method of detoxification. The herb which we will take, we have to use 4 times of water and reduce it to 1/4.
One.
That is the general rule.
So we can also just take only oil. Only oil is also.
Yeah. But that oil is also lukewarm.
Okay.
Not cold, not too cold, not too.
And again, in this also, the heating should be indirect to the oil.
Yes.
Just like in other procedure.
Yes.
Okay.
After Kavala Gandusha, the pH of the mouth is expected to increase or decrease.
It's depend upon the medicine.
Medicine that we will take.
It's depend upon the medicine which is used. If the medicine has Tikshna guna, this will create the acidic pH in our mouth. If the herbs are having alkaline property, this will increase our pH in our mouth.
And every time we do this, before that we have to massage the neck and everything, right?
Yes.
If we do a simple salt water,
You can face both.
then it will be
Salt water has a special capacity that has lekhana property, scraping property. If there is excessive secretion in the mouth, this will reduce the secretion. If the salt water will reduce the secretion and also reduce the inflammation in our throat. So that's why we are advised to gargle in case of pharyngitis like condition.
So what kind of emergency situations or what symptoms might arise?
Symptoms.
Any aspiration?
These are the
like
symptoms. If we do it more than our tolerance capacity, that there is dryness, more dryness in our mouth, improper taste perception, okay, loss of appetite, excessive thirst we have. Because for that symptoms we will do the basically we will doing that procedure, that we will get benefit from that the main procedure. But if we don't taking precautions, or if we will doing more than our tolerance capacity, instead of giving us benefits, the procedure harm to us.
So you
And
said
how
about the
often?
cold milk, whether it
Yes.
should be the kept in the fridge,
No, not-
such
not
kind of
cold
cold
milk,
milk or normal?
Normal temperature.
Room temperature.
No, we can also use more than normal temperature milk.
And how often a healthy person can do it? Every single day
Healthy person
can do this. Every single day.
every day. We can alternate the media, maybe on alternate day. Maybe today we will do it with hot water, tomorrow we will do it with
Oil.
sesame oil, and on the third day we will do it with the tripla decoction. But basically, if we are doing it for any therapeutic purpose, then firstly we have to assess what problem the patient have. According to that, we will prescribe the herbs or oil or that for the procedure. So last procedure is AkshiTarpan. Anyone get bored?
No,
We will
no.
take break of 5 minutes.
No.
That's okay.
Very interesting.
Shall we proceed?
Yeah.
So last procedure is AkshiTarpan. So basically, what is AkshiTarpan? It is the nourishment of the eye through the medicated snake. The snake basically which we use is ghee. Indications: when a patient sees darkness in front of eyes, in severe dryness of eyes, feeling of stiffness in eyes, falling of eyelashes, medrosis, deviated eyeball, in extreme aggravation of the diseases of eye, glaucoma, conjunctivitis, difficulty to open or close the eyes. These all are the indications in which we will prescribe AkshiTarpan. Contraindications: cloudy day, excessive hot and cold season, anxiety, physical exertion, when complications like inflammation, redness, severe pain, etc. persist in the eye for a long time. Giddiness. Pre-procedure: patient is asked to lie down on his back in a chamber free from direct sun rays, wind and dust. Patient is given mild fomentation with a cotton soaked in lukewarm water. Main procedure: a wall of paste of powdered marsh pulses is constructed around both eyes. The patient is asked to close the eyes, and over the closed eyes, liquefied grit is poured very slowly till the entire eyelashes are under the liquefied grit. The patient is instructed to slowly open and close the eyes. After the prescribed time is over, the ghee is drained out through the hole made near the outer canthus. The eye is irrigated by lukewarm water fomentation.
So this is a picture of AkshiTarpan.
It's open.
These are made up of marsh dal,
Flour.
urad dal. Okay, urad dal. Pit is made up of urad dal, and after pouring the grit, we have to instruct the patient to open and close the eyes. Okay, and the oil we have to pour till the eyelashes of the patient not dipped in the grit properly.
Post procedure: after finishing the main procedure, dhumpan, that is medicated smoke, is given to the patient. Then patient is advised to avoid direct exposure to excessive cold, heat, wind and shiny things. Period of retention: 500 to 1000 matras. So what is matra? Matra is the time required for blinking the eye for once. So in the modern time, 1 matra is equal to basically 1.5 second approximately. So the retention time is 12 to 25 minutes according to the condition of the eye. Complications: features of heaviness, indistinct vision, excessive lacrimation, itching, stickiness, dryness, intolerance to light, aggravation of the disease.
Complications arises.
What to do when a
Complication arises, then what steps should be taken?
Complications: firstly we have to stop the procedure immediately. Okay, and then according to the complications, consult to your Ayurvedic physician.
Okay.
Suppose irritation is more, eye irritation, then what to be done?
I can grab the collar and
If eye irritation is more, then we have to use any cold thing to for if eye irritation is more, Soumya eye drop of Patanjali companies,
You can use the gulab jal.
gulab jal.
Okay.
It is also made up of gulab jal, the Soumya eye drop. So we have to
Do the Shita Upchara.
A patient develops a kind of worry now.
Yeah.
we have, as a physician we have to match that worry. That is basically our task.
Yeah.
Anxiety.
And why this urad dal only? The atta, it has to be like
It has wooden sticky
okay.
binding property.
Okay, got it. It
That's
doesn't let the oil come out.
Okay, how important it is to follow post-procedure steps, because it becomes very tedious for a person after doing this therapy follow post-procedure steps. So how important they are?
They are very important to follow the post procedure process also, because if we have don't instruct the patient to go in cold weather, you don't have to go in cold weather or cold.
It's fine. These are the precautions. But what about room that taking smoke, medicated smoke after this procedure? So how important it is to take after this therapy?
It is important because even after AkshiTarpan there is excessive cough dosh. There is that is remains after the procedure. So to vitiate that excessive cough, we have to do the dhumpan.
Is that with open eyes or closed eyes?
This is with open. We need to open the eyes and then close it. And what if
Dhumpan we have to take with the nostrils.
Yeah, that's fine. I'm asking whether it's with open eyes or closed
Open eyes, open eyes.
Open eyes also.
Yeah.
So first we pour the oil or ghee and then they need to open the eyes and then close it, right?
Yes.
And what if the oil and everything gets into your system? So that's fine?
Yes.
It's not dangerous?
No.
How many
And
times
it's-
you should close and open the eyes during the procedure?
When
Not
the
any
process-
particular fixed time, but we have to instruct the patient. So according to the convenience of the patient, we have to ask him.
And only one time we need to open and close.
So what is the duration of this period?
It is basically depends upon the disease. But if we do it on a healthy person, then as I asked, 500 to 1000 matra. So 500 matra is for healthy person. So the time period that we will convert 5 matra into the modern time, modern measurement, it will 12 minutes. So minimum 12 minutes, maximum 30 minutes.
I mean, if it's all about putting the oil in the eye, then why not you just put the drops? Why do you just do all these things?
If we put the drop, that is some other procedure, that is AkshiTarpan.
Then what's the difference? Like, anyways, the oil has to go inside the eye, na?
Yeah.
So why not to put the oil like that? Why to just make all this jet like powder putting the oil isn't it too much?
Because when we put the oil, we will continue nourish the eye with lukewarm grit.
Okay.
So for 30 minutes the lukewarm grit came in contact with the eye.
Okay.
So all the diseases.
Okay. Any particular
Would
grit
this
we
be
use
useful
this?
for
Maybe tripla grit.
Tripla
The
grit.
commonest grit is tripla grit.
Tripla grit. Okay.
Tripla grit, Mahatripla grit, but the commonest is tripla grit.
Ma'am, could this be useful for dark circles?
Dark circles.
Yeah.
Would it be useful
As compared to modern
Dark circles, no, not so useful for dark circles.
You can use neem.
And also, ma'am, if there is a fungal or redness in the eye,
Yeah.
so then we can use it, right?
Yes.
Because one of the patients, he is having this redness. When he went to a hospital, they said they could not identify the root cause. They said it could be because of some fungus. So,
We can use it. This is very beneficial.
which oil should we use?
Grit or tripla grit. The
No.
basic and commonest we can use, that is tripla grit.
No oil, right?
No oil,
Only.
Not even normal ghee.
No, we can use normal ghee also. If we don't have any other medicated ghee, we can use normal ghee. But the outcomes that we desired, that not will be completed by that normal.
Now imagine when we put the oil in the hand, it's very hard to take it off, right? You use the soap, even it doesn't come out.
Yeah.
How do you take it out from the eyes?
We take some cotton swabs and dip them with in lukewarm water, and then we wipe off all the oil that is
So it
remained.
won't stick in the eyes.
No, no, no.
But on the layer, its skin it can stick.
And
You
also,
should experience today.
Okay.
if you have cataract or something, right, lens already installed,
Yeah.
can we use this procedure or we should
We
not?
will use this procedure, and how much the beneficial is that depends again on the severity of the disease.
Okay. Because once they have this cataract operation,
Yeah.
then there will be a lens
Yeah.
which they have, but still we can do this procedure. Okay.
We'll take out the lens, huh?
No, we not to take out the lens.
No, if somebody has an eye operation, they got lenses like implant inside, so can we go for that thing? This
Yeah.
thing?
If the lens is already implanted,
Yeah,
then we will not prescribe that.
Okay. To the natural eyes, like.
Yeah.
Okay, so cataract also, once the procedure or normal operations are done, it is better
Yeah.
not to,
Yes,
we
yes.
should not use it.
Yes.
Honey can be used.
No, no, only
In
ghee.
AkshiTarpan, honey
The
no.
Triplanjana, in Triplanjana there is a Tripla and honey.
Yeah.
And tripla and ghee is also there. So in this AkshiTarpan, can we use both together?
No, we can't use honey because Anjan is basically a different procedure and AkshiTarpan is different procedure.
And if person keep more time opening eye, is it okay?
More time opening eyes.
Means open eye would be okay.
Yeah. It is more beneficial.
More better.
Yeah.
That's
Because more the time he will open the eyes, more the medicine come in contact with the inner layer of the eye. So it is more beneficial. Yes. Any other query regarding all the 4 topics?
Will this improve the eyesight also?
Yes. For all the refractive errors, we can use it.
Okay, can it be used for cataract reduction or reversal? Some sort of nothing?
Depends upon the severity in the cataract. If it is the initial state, it may be beneficial, but if it is in the later state, then it is not beneficial.
Can it be used in regular base?
Yeah.
Regular base means weekly or daily?
In regular ways, we can use it daily for 7 days.
Continuous.
7 days per month.
7 days in a month.
Alright.
So why we keep the...
Or for a healthy eyes, we can also do it on an alternate day also.
We are applying a kajal every day.
Yeah.
So it can be used every day also.
Yeah.
What are the different eye drops which are available in this institution? You are preparing, no? Here?
Eye drops in this institution we will use it.
This Tarpan, which drop should be used?
No, we will using grip for that Tarpan.
We do
Not using any eye drop for the Tarpan, we will using grip only.
we do the fermentation first, right? And then we do.
Yeah, there is no massage in that procedure, only fermentation, mild fermentation that we have to dip the bottles back. Okay, and then we will see the temperature because eyes are more sensitive part of our body.
So we do it around the eyes.
Yeah, only mild fermentation.
Would it reduce the number of glasses? Would it be reduce the number of glasses?
Yes.
Sight.
Can you demonstrate?
Eyes will stick to only.
Yes, all the 4 procedure will be.
Eyes will stick to only. Number of eyes will.
I have a simple doubt.
Yes.
Whenever they say improves the eyesight, no? So now whether it is improving myopia, improving hypometropia or presbyopia?
Everything.
As per the research, it is more beneficial in case of myopia.
Myopia.
Yeah.
The number of eyes will stay
So
same,
when you
right?
say more beneficial,
Number of eyes will stay same.
hypometropia can get some benefit?
Yeah, we can get some benefit, but in case of myopia, there is a research-based clinical improvement.
Myopia has a proved research, but in case of hypermetropia, we don't have that much proof.
We can do this.
Case of hypermetropia, but it can give some results in that also.
Last one.